How do I look up a patient's information in their chart at the beginning of my shift? I always try to spend a couple minutes at the beginning of my shift, if I can, looking up all of my patients to kind of get a good foundation for why they're there, what we're doing, what's the plan of care, their labs, imaging, all that. So I'm going to kind of run through what I normally look up. I like to start off by looking at the patient's history and physical admission note for when they were first admitted to the hospital, followed by the most recent provider progress notes from whatever physicians are currently seeing the patient. This gives me a good idea of what groups or physicians were seeing the patient, so that way I can anticipate them coming that day to round on the patient. I also like to look up the patient's most recent labs, and if anything kind of jumps out at me, I like to look back a couple days on the trends. For example, if I see a patient that has a white count of 38, I'm going to look the previous day and see what was it. Because if it jumped from 15 to 38, that's a lot more concerning than if it went from 45 to 38. I'd be like, okay, we're trending down. I also like to look up any recent imaging. So if a patient's had a morning chest x-ray, a recent CT scan, MRI, what are the results of those imaging scans? I also like to briefly look at what medications I'm going to be giving that shift in case anything kind of jumps out as missing or maybe something I shouldn't be giving. I also like to look at whatever drips the patients are on, current drips, current rates, and I'll also briefly look at the patient's I&Os from overnight, because a lot of times providers come in and want to know what was the patient's urine output last night, how much total fluid have we given them. So I like to kind of know that right off the bat, because sometimes physicians start rounding like the second you get there. I'll also look at the patient's vital trends from overnight, and then I'll briefly run through all their orders to make sure there's nothing that pops out as like missing or something that's pending. For example, if they have maybe a procedure that day or a surgery that day, I want to make sure I'm prepared and don't miss anything. Or if the patient needs to be NPO at a certain time, I don't want to miss that. So yeah, it sounds like a lot, and I guess it is a lot, but typically I don't spend more than like 5 minutes per patient looking through their chart, because I like to get right into doing all the things for my patient. I feel like I can best learn them when I'm actually looking at them and seeing what's currently going on. So that's that.